Greetings everyone. Today I'd like to talk about disease prevention strategies, and in disease prevention we are talking about the actions of stopping or curbing something or a disease from happening. The aim is to keep everyone healthy, and remember our definition of health is a complete state of physical, mental, social well-being of an individual, and not merely the absence of disease or infirmity. That's a definition by World Health Organization. Prevention of disease also aims at avoiding the risk of poor health, that is illnesses, injuries, and even early death. So the natural history of a disease is classified into 5 stages. There's the underlying stage, where in the underlying stage we find that there is no risk factors to developing a disease. Then we have a susceptible. This is somebody who is prone or predisposed to the risk factor of developing a disease. Then the third stage is subclinical. Subclinical is where the risk factors are present but no disease condition is present. Then the clinical stage is where an individual manifests with the signs and symptoms of a disease condition. Then finally there is the recovery, disability or death. So these are the impact of what is experienced after somebody presents with a clinical stage of a disease. When treated early, this patient or person will recover. When treated late, there can be morbidities, that is disabilities, and if there's late or for some other reasons, somebody can also die. So the levels of disease prevention also follow the stages that I've talked about in the previous slide. These strategies not only aim to prevent the onset of disease through risk reduction, but also to curtail complications of a disease condition. So we have the primordial, the primary, secondary, tertiary, and even the quaternary prevention measures. So here they are. So when we are talking about primordial, we are going to look at the individual education prevention measures. We're also going to talk about the mass or group education. Then the primary prevention, it involves health promotion and specific protection measures. In secondary prevention, looking at early diagnosis, treatment and referral. In tertiary prevention, we're looking at disability limitation and rehabilitation. And what is meant by quaternary prevention is prevention from medication harm, where somebody maybe is put on treatment and yet they even did not need that treatment in the first place. So let us now look at these measures in detail. So for primordial prevention, it consists of the risk factor reduction targeted towards an entire population through a focus on social and environmental conditions. So it involves promoting health through laws and national policies. It also targets the underlying stage of natural disease by targeting those conditions like social conditions which promote or enhance disease onset. This primordial prevention was first described in 1978. So it is the earliest prevention strategy in preventing a disease occurrence. So here the individual does not have a risk factor to a disease. So the aim is to reduce the risk of exposure to the conditions. Primordial prevention can be promoted through government policies or national laws. For instance, if a government does not want citizens to be exposed or predisposed to lung cancer, the government can increase taxes on cigarettes so that it becomes inaccessible to majority of the population. We know cigarette smoking is associated with lung cancer. Can also enforce laws restricting advertisements on tobacco, just to ensure that people don't get any misleading information that tobacco is good. Then the other one is built on environment, that is access to safe walking paths, where people will now be safer from being knocked by moving cars, ensuring that stores have healthy foods available to the general population, improving access to urban neighborhoods to safe pavements where people can walk through, or where people can do some physical activities, jogging, running around, which, if enforced, can reduce the risk of developing obesity or non-communicable diseases like hypertension and diabetes among adults. Number 2 is primary prevention. In primary prevention, this is where there are risk factors, but there is no disease condition. So the purpose of primary prevention is to prevent the disease from ever occurring. So actions taken here are before the disease onset, and the actions limit the risk of exposure or increasing the community or individuals at risk to prevent disease progression in a susceptible individual to subclinical disease condition. So it targets a population that is healthy, and the major activities here involve health promotion as well as specific protection measures. So here they are. Environment modification is one of them. So in primary prevention that is concerned with environmental modification includes clearing bushes. For instance, if you are suspecting or you want to deal with mosquito breeding or even breeding of snakes around those bushes. It also involves draining stagnant water, building roads, and also putting berms on the roads, putting signages on the roads, land leveling, planting trees within the environment. All those activities are for environmental modification. Then there's health education. At facility level, this can be done on different topics, on health related issues. Can also be in between the sessions. So facilities can invest in a television set where the health messages are played, and these televisions can be installed on patient waiting bays at every service delivery point. So you'll be passing the key health messages to the patients or the clients that come to the facility. You can also do health education at community level through outreaches. Then lifestyle and behavior change is another health promotion activity where you advocate for a good lifestyle that is not going to predispose an individual to risk factors of developing diseases like responsible behavior, not engaging in casual intercourse maybe, drug use, all that. Then there's nutritional intervention, and we're doing counseling on a balanced diet so that people do not develop malnutrition. And to the specific protection, one is to have immunization. So you immunize those who are eligible for those immunizations against diseases before they happen. For instance, when a child is born, we know they are given BCG to prevent TB, also polio vaccines, measles vaccines, and currently we also have COVID-19 vaccinations that are being given. Then food and drug safety. In food and drug safety, this involves activities like screening food handlers, testing them for these communicable diseases or diseases that can be transmitted fecal-orally. Also occasionally do sampling of foods and then taking them to the lab just to ensure that they are safe for consumption by members of the public. Then vitamin A supplementation, also done to prevent people from night blindness, for instance. Then also have environmental control measures, for instance preventing air pollution, preventing water pollution, advocating for use of latrines or toilets instead of open defecation. You also have chemoprophylaxis, where individuals are given certain drugs to prevent them from developing certain diseases. For instance, giving TB preventive treatment to those at risk of developing TB disease. You also do RTA prevention as well as gender-based violence prevention. You also do quarantine for those who are considered to be exposed to the risk of infectious diseases. So they are quarantined to prevent transmitting the disease, the infection, if they have it, to the rest of the population. We also do hand washing. This is to prevent the fecal-oral contamination that might give rise to certain diseases. Then for secondary prevention, this emphasizes early disease detection, and its target is healthy appearing individuals with subclinical forms of the disease. So here the disease condition might be present, but the individual might not have been diagnosed with the condition. And when they are diagnosed, the aim should be to prevent the disease from further progressing. So under secondary prevention, we have screening, and the types of some of the screening activities that are done are like pap smear in preventing or in detecting cervical cancer, self-breast examination or doing mammography to detect breast cancer. You also do colonoscopies to detect colon cancer early. You do blood pressure screening to just ensure that people don't have hypertension. There are also certain laboratory tests that you can do, as well as radiological examinations. The second secondary prevention measure is giving treatment. This is where an individual has been diagnosed with the condition, and therefore appropriate treatment is given. For example, they can be given medication for specific conditions. Those who need surgical intervention can undergo surgeries. For those with the mental illnesses or mental conditions can benefit from psychotherapy. Those with the cancers, for instance, can benefit from palliative treatment. And those with infectious diseases, they can be isolated in isolation facilities to prevent them from infecting others. Finally, there is the referral, and the aim of the referral is to ensure there is continuity of care among individuals. If a patient presents at a lower level facility and the medics there feel the patient can benefit from services at higher level facilities, then these patients can be referred promptly so that they benefit as soon as possible they can benefit from the services that they need at those higher level facilities. Next is tertiary prevention, and in tertiary prevention it is implemented in symptomatic patients with the aim of reducing or limiting disability or even severity of this disease and its associated outcomes. Tertiary prevention therefore targets both the clinical and outcome stages of a disease. When we looked at secondary prevention, the aim was to prevent the onset of illness. So it was to prevent disease from ever occurring. But in tertiary prevention, the aim is to reduce the effect of the disease once it occurs. Normally when a disease sets in, or when a disease occurs, it can progress to impairment, to disability, and finally to handicap if there is no prompt intervention. So when we talk about impairment, it's just loss of or an abnormality of anatomical structure, physiological or psychological functions of an individual. Then disability refers to restriction or inability to carry out an activity, while handicap is disadvantaged individuals occasioned by impairment or disability that limits or prevents them from fulfilling their day-to-day roles. The other activity under tertiary prevention, apart from disability limitation, is rehabilitation. So rehabilitation here involves combined and coordinated use of social, medical, vocational, and psychological measures. When we talk of social rehabilitation, we mean restoration of an individual's family or social relationship that might have maybe ended because of the sickness. Then medical rehabilitation is the restoration of bodily functions, for example, movement of certain body parts or limbs. When we talk of vocational, it's just restoration of ability to earn livelihood. Maybe somebody suffered and this individual was the sole breadwinner. So you rehabilitate them by ensuring that they retain or regain their livelihood. Then psychological measures involves restoration of a person's mental well-being by restoring their dignity as well as their confidence. So the examples under tertiary prevention were occupational and physiotherapy. In a burns patient, we know some burns that may be involving the joints or the fingers can end up in contractures. So to avoid contractures, you need to do occupational therapy or physiotherapy to such individuals. Then can also do cardiac rehabilitation in somebody who has suffered myocardial infarction. We also take care of the feet for diabetic patients who have diabetic feet to avoid the possibilities of developing gangrene, that is loss of blood supply or oxygen supply to the affected areas, and if this is not taken care of, can result into an individual undergoing amputation. So use of crutches by individuals who suffered polio, It's also another example of activities, tertiary prevention. Then giving prosthesis to individuals who underwent amputation of the limbs maybe. So you give them prosthesis at least to help them. The final disease prevention strategy is quaternary prevention, and this is defined as an action taken to protect individuals or persons or patients from medical interventions that are likely to cause more harm than good. Remember, medicines or the aim of treatment is to always do good to patients, but not by not doing any harm to them. But there are instances where medics don't have a definitive diagnosis. In cases where patients now present with symptoms, signs and symptoms, but there is no definitive diagnosis that is made. So they end up being given medications that they don't even deserve in the first place. So here the aim is to prevent patients that have or that are presenting with illnesses but they don't have a disease. They have complaints that they present with, but there is no diagnosis that is made on them. So you find that exposing them to drugs that they don't need will also predispose them to getting certain conditions. You can refer to my presentation on antimicrobial resistance for such kind of cases, where you find an individual is put on treatment and yet there is no definitive diagnosis that is made. So quaternary prevention aims at limiting such. Activities under quaternary prevention involves being watchful or vigilant on conditions that are susceptible to overtreatment. For example, radiological incidentalomas. So these are incidentally discovered mass or lesions detected by radiological examinations like CT scan, MRI, that are performed for unrelated reasons. You perform this not because you are looking for incidentalomas, but you are performing the radiological examinations due to other conditions, but incidentally you get the lesions or the masses. So recently there has been an increase in the number of findings detected that are not related to the primary objective of the examination. So you can find that medics now put patients on treatment for such. The other one is use of antiarrhythmias. So these are drugs that are used to correct the rhythms, especially after myocardial infarction. So in most cases they end up having mortality. So we should keep watch on this. Then the use of hormone replacement therapy that lead to an increase in the number of cases of maybe cancer of the breast or even stroke. In some cases you end up having blood clots in the blood vessels at some point. Then we also have medically unexplained symptoms. This is where people have persistent physical complaints, e.g. like dizziness, pains, that don't appear to be specific symptom of a certain health condition. These conditions, these symptoms may last for weeks, but tests that are done or that are ordered for do not give a definitive diagnosis. So from the patient's point of view, they are genuine. They are genuine symptoms. But from the medic's perspective, there is no diagnosis that they can make out of these conditions or the complaints that the patients are presenting with. Then there are functional disorders. There are some physiological findings that can also be considered as disorders, but they don't need any medication to deal with them, but you find there are instances where medications are given for them. Then there's also the bodily distress syndrome. These are newly proposed diagnoses of medically unexplained symptoms and are based on empirical research in the primary healthcare. So it is common among primary healthcare patients, and those with the condition have a higher probability of poor physical and mental health. So they don't need any medication, but there are instances where medicines are given. So quaternary prevention should aims at preventing such cases from being given medications that they don't deserve in the first place. So with that, come to the end of today's presentation under this topic of disease prevention strategies. For more of such health education, please remember to subscribe to my channel. Remember also to like, comment, and share with your networks. Thank you, and let's meet in my next presentation.